Yeah, definitely. Just to build on Jennifer's point there, it's this idea, especially in loneliness research. Historically, we've always put loneliness and social isolation together. There's always been that conflation of terms, and that's not necessarily the case. Melody touched upon it earlier, but loneliness is this experience or this feeling that we get when our expected number of social connections or the quality of social connections that we have do not meet the expectations that we have. So if you expect to have 500 close friends and you only have 300, I see people laughing, 500 is a lot. Let's say you expect 50 close friends and you only have 30, then that discrepancy between how many social connections you actually have versus how many you expect, that's going to result in loneliness. However, social isolation is a more objective concept. It's how many social connections or interactions that you have. And that's a point that we touched upon just before, is this idea that it's all about expectations. If you don't expect to have a lot of social interactions and social connections, then you're not going to get lonely. It's when you have those high expectations, that's when loneliness kind of develops. So it's this idea that Stephen touched upon, you can be in a crowd like this room and still feel lonely because you don't feel connected to anyone here. Or you could be completely by yourself in your room, and if you have zero expectations of social connection, you're not going to feel lonely from that perspective. So, I mean, I shouldn't be saying this as a loneliness researcher, but the pandemic and working from home, I did not mind that. Kind of what Jennifer was talking about, sometimes being in an office and being around everyone, having to be on all the time, that can kind of drain your social battery a little bit. So if you have less expectations or lower expectations, I guess it's hard to get more disappointed.
So what sets those expectations?
That is a subjective thing. I think it comes down to your own kind of values and what you specifically desire. And this is where I think technology plays a very integral role, especially social media, where we are seeing the best of what people want to present to us. People see other people at parties or having good relationships, or this is the idealized version of what they have, and that changes people's expectations of what they want in their lives. And if you're not meeting that, then that's where this disappointment and this mismatch and this loneliness kind of comes up a little bit.
So that brings us into the information realm as well. But I wonder, before we leave that, the issue of personality, do you think sort of differences in people are inherent, biologically inherent, or determined by prior experiences? So your expectation has some mapping back to your type of personality. Is there good evidence for that? It seems sort of intuitive.
There is evidence regarding your own kind of personal, I guess, your personality, and that is made up of your social context and the environment that you were brought up in. We also see during research there are certain countries or certain cultures that are more either, let's say male or masculine or male dominated, where these expectations are kind of instilled upon you from a younger age. And so those cultures tend to be a little bit more reserved, less open to kind of this mental and this social aspect, and that kind of manifests in itself. But then you have other more kind of individualistic cultures. You have others that are more social cultures, and all these definitely play a part to who you are and your expectations. So the tricky thing of loneliness is, because it is so subjective, there's really no one-size-fits-all solution. And someone, I did an interview the other week, and someone asked me, do I think it's possible to completely eliminate loneliness? And no, I don't think so, because it is so personal to you that there is no magic pill that you can take to make people not lonely anymore. And I don't think that that should be the goal as well. Like Melody mentioned, loneliness is akin to hunger and thirst. It's a trigger within you to say, something's wrong, I should go and make some social connections. So I don't think necessarily eliminating loneliness altogether is possible or should be what is warranted. I think we should be aiming to reduce problematic and prolonged loneliness. But loneliness itself is so unique to the person that I don't think there is a feasible one-size-fits-all treatment.
So, Melody, do you think we've over-medicalised it? It sounds like we might.
I think that traditionally too much attention has been paid to the individuals. I mean, there are aspects of the loneliness is maladaptive thinking, to change your way of thinking. I mean, reflecting on myself, that the idea of having a spotlight over me, kind of being watched and being hypervigilant about social threat, that is something that can probably be improved through counseling with a psychologist or something like that. But again, like what I emphasized in the talk, I felt that way because the environment didn't make me feel a sense of belonging, because the environment didn't make it easy for me to socialize with others. So I think that this conversation is still quite recent because traditionally loneliness has been more discussed in the field of psychology, and it's very recent in public health. And that's why I think that we have to take a public health approach that is more about the upstream solutions, to seek for the environment for the answers. I think that is really the next stage of how we talk and, tackle loneliness. I'm not going to use the word treat.